Josh Valentine. The date is 10-21-15. I'm going to be observing the cranial nerves. First, I'm going to start with cranial nerve 1. I'm going to have you plug one nostril. Take a deep breath for me. Okay. Plug the other nostril. Take a deep breath. Okay. Now I'm going to have you close your eyes and plug one nostril. I'm going to give you a scent and let me know if you can smell it. Okay, breathe.
Yes, I can smell it.
Okay, other side. Inhale. Is that scent familiar?
Yes, smells like coffee.
And is it the same intensity on both sides?
Yes, it is.
Okay. Cranial nerve 2. Getting the fundoscope out. I'll have you look straight ahead at the Ebony magazine. Okay. I'll be observing for any abnormal findings, which would be AV nicking, hemorrhages, or palpable edema. And then now I'm going to do the 1, 2, 5 exam. I'm going to have you cover one eye and look straight here at the S in my chest, like Superman. Okay, I'm going to put a number 1, 2, or 5 out. Tell me what you see.
2, 2, 5, 1, 1, 2, 5.
Okay, now cover your other eye.
1, 2, 1, 5, 2, 1.
Okay. Now I'm going to be doing the direct and consensual test. I'm going to have you look straight ahead for me. For this, I'm going to be looking for any abnormal findings, which would be the pupils not constricting well, or on either side, or both. The normal finding would be both constriction. Now I'm going to do the pupillary fatigue exam. Look straight ahead for me. Okay, and an abnormal finding there would be that the pupil will not be able to constrict or stay constricted. Now I'm going to observe for ptosis, and now have you close your eyes. I'm going to observe for blepharospasms spasms. Okay, now I'm going to do the accommodation and convergence test. I'll have you look at my finger, look at the wall, look at my finger, wall, finger, wall. I now follow my finger. Okay. Now I'm going to do the H in space test for cranial nerves 3, 4, and 6. I'm going to have you look right at my finger and follow it. Now I'm going to do the X test. Follow my finger. Okay, now I'm going to test cranial nerve 5. I'm going to use a pinhole for pain. You feel that? Actually, I'm going to go this way. You feel that?
Yes.
You feel that?
Yes.
Is it the same intensity on both sides?
Yes, it is.
You feel that?
Yes.
You feel that?
Yes.
Same intensity on both sides?
Yes.
You feel that?
Mm-hmm.
You feel that?
Yep.
Same intensity on both sides?
Yep.
Now I'm going to use the cotton to test light touch. Feel that?
Mm-hmm.
You feel that?
Mm-hmm.
Same intensity both sides? Feel that? You feel that?
Mm-hmm.
Same intensity both sides?
Yep.
You feel that? You feel that?
Yep.
Same intensity both sides?
Yep.
Was it same intensity throughout?
Yes.
What about with the pinwheel?
Yes, it was.
Okay. Now I'm going to have you bite down. I want to feel the masseter, temporalis. Now open your jaw. I want to push up and resist against me. Okay, now I'm going to test motor for cranial nerve 7. I'm going to have you raise your eyebrows, close your eyes real tight, now smile. What's the funniest thing you've heard all day? There we go. Okay, now puff out your cheeks. Okay, now I'm going to do the cranial nerve 8 exam. And I'll have you close your eyes. Can you hear this?
Yes.
Let me know if you can no longer hear it.
Now.
Alright, look to your left, let me see it, so you can see the difference. Okay, now go to close your eyes. Can you hear this?
Yes.
Let me know when you can no longer hear it.
No.
Okay, look to your right. Alright, we're about the same there. And then now we're going to do the Weber and Renee test. Can you hear that?
Mm-hmm.
Is the same on both sides?
Yes.
Okay, now I'm going to do the Renee test. Can you hear that?
Yes.
Let me know when you can no longer hear it.
Now.
Can you hear that?
Yes.
Can you hear that?
Yes.
Let me know when you can no longer hear it.
Now.
Can you hear that?
Yes.
Okay, that would be if it is air is greater than bone on the same side, it would be a neurosensory loss on the sensory neuro loss on the opposite, and if it is bone greater than air, it would be a conduction loss on the same side. Now I'm going to have you stand up for me. I'm going to do the tandem gait test. I'm going to have you walk heel to toe with your eyes open, look straight ahead for me. Okay, good. I'll come back and I'm going to have you do the same thing with your eyes closed. Okay, good. I'll have you sit back down for me. And I'm going to test for nystagmus. Look straight ahead for me. Okay, good. Now I'm going to test cranial nerve 9 and 10. I'm going to test for palate elevation. Open your mouth up for me, stick your tongue out. Say ah, 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 ah. Okay, if there's any abnormal findings, the uvula will deviate to one side or the other. Actually, I'm going to check for gag reflex. Open up and stick your tongue out for me. Good there. Other side. Okay. Now I'm going to test cranial nerve 11 with the tested trap and SCM. Okay, raise up against me. Okay, now look to this side and resist against me. Okay, look this side, resist. Okay, now cranial nerve 12, I'm going to have you open your mouth, look for any atrophy or fasciculations. Okay, now I'm going to have you stick your tongue out for tongue protrusion. If there's any abnormal findings, it would be the tongue will protrude or deviate to the left or right. And then now I'm going to finish with the muscle test for the tongue. So have you stick your tongue against your cheek, resist, other side, resist, and that's it.